I'm Dr. Timothy Johnston with your post-operative instructions for a sinus communication. This is not going to be what you came in for, it's going to be what you ended up with. Typically, a sinus communication happens when an upper tooth is removed, or a bone graft is placed, or an implant is placed or removed. And what has happened is the bone, that very, very thin bone that makes up the floor of your sinus, also makes up the roof of the tooth socket or implant site. When it's really thin and a tooth is removed, sometimes the bone comes with it, and then you have an opening that goes straight from your floor of your sinus into the roof of your mouth. So to put that in some graphic terms, you could take a drink of milk and then spit it out your nose. It might be a cool party trick, but it gets old quick. So let's talk about the care of that. That sinus communication would have been completely repaired while you were in the office. However, that repair is delicate, very delicate. So we need to talk about how to maintain that and not have it blow out. Number one, just from the procedure that you had anyway, whether it was a bone graft or a socket preservation or an extraction with that, the general rules of how to help that heal apply. And that is ice it down for a couple of hours, continue biting on the gauze you were given for a couple of hours, changing that gauze out once in a while. If it continues bleeding a little bit because maybe you're on blood thinners or even just an aspirin a day, then a good way to control the bleeding if it won't stop on its own after 2 hours is to grab a tea bag. Black tea is better, but green tea works. Dip that tea bag into a cup of cold water, wring it out, and put that over the surgical site. And you'll find that the tannic acid that naturally occurs in tea leaves is a tremendous promoter of blood clotting. Those are the general rules that you would have anyway. Now let's talk specifically about the communication between the sinus and the floor of your mouth. Number one, no smoking. That really inhibits the ability of your red blood cells to carry oxygen to the wound. You can brush normally in the area because that's not where the communication is in the normal brushing area. You can also eat fairly normally, again, unless the procedure itself, say a bone graft or something like that, prohibits that, in which case you should have gotten a second video with this video that tells you all about how to care for the bone grafting and or implant site if it was multiple implants with a membrane. If you're wearing dentures, you can continue wearing those, although don't eat anything hard on them. And if you were given prescriptions for antibiotics or any kind of painkillers, continue to take those as well. You'll find that we don't prescribe a lot of narcotic painkillers simply because we find that the combination of 2 extra strength Tylenol, that's 1,000 milligrams, along with 600 milligrams of ibuprofen, which is 3 Advils, the combination of those 2, Tylenol plus Advil, at the same time is very, very effective. In fact, more effective than the narcotic painkillers. And you don't get the upset stomach and the headache and the dizziness and all that you would. So that's there. Now let's talk specifically about maintaining this site so that you can't blow milk out your nose. For the next 6 weeks, all of what I'm going to say applies. We need to prevent there from being any pressure, either positive or negative, in your sinus or in your mouth. So that means for the next 6 weeks, no sucking through a straw, no puckering up and sucking in like that, no making kissy faces across the room to somebody. If you're going to sneeze, let it go. No stifling sneezes. I don't want to see that you went and stifled it and then you put all that pressure up in your sinuses. For the same reason, you can't blow your nose. Correct. You can't blow your nose for 6 weeks. So not to be graphic, but you got to pick a different activity. You can wipe it, pick it, rub it. I don't care what you do, but do not blow your nose. Every time you put that pressure in your sinus, you run the risk of blowing all that air pressure right out through the sinus and into the stitches and opening that completely up. And now you've got that communication back again, and it won't heal up on its own. We'll have to go back in and do that procedure all over again. Same thing about negative pressure, so no sniffling either. You know, I said don't blow your nose, also don't sniffle your nose. You literally just have to kind of carry around a hanky or a box of tissues to get that done. If you are having a real problem with congestion, use a nasal decongestant. Use Afrin or something like it, or even one of the pills that helps to decongest, one of the antihistamines, to help decongest your sinuses. If you're using an Afrin type spray, it tells you to squirt and sniff at the same time. You sniff very lightly. I already told you no sniffling really. Just kind of spray it up there with a normal breath and you'll be fine. A lot of people ask me if flying in a plane is okay, and yes it is because they're pressurized. However, scuba diving is not on the list. And I would say that goes longer than 6 weeks. Scuba diving, you're purposefully trying to clear your nose, so you want to avoid that for about 3 months. If everything heals well, it won't feel like anything different happened. If it's not healing well, you'll start to notice that there's a little gurgling sound happening between your nose and your mouth. We're going to have you in for a post-operative check no matter what. But if you start to notice something like that happening sooner, please give us a call right away so that we can repair that properly. Thanks for watching.